Heart disease used to be considered a man's disease, but that's no longer the case. Globally, heart disease is the #1 killer of women over 35 years old, accounting for more deaths every year than all cancers combined. This video will teach you some of the ways heart disease is different for women compared to men.
Women generally have higher heart rates and smaller hearts and coronary arteries than men. Female hormones make arteries smaller, more prone to blood clots and blockages, and more difficult to repair. Women tend to have less buildup of plaque in their arteries, and the plaque they do have tends to behave differently.
Men and women have the same traditional risk factors for heart disease. For example, high blood pressure, high cholesterol, diabetes, smoking, obesity, unhealthy diet, physical inactivity. But some of these risk factors are more likely to result in a heart event in women, and some are more common in women. For instance, if a woman uses tobacco, has diabetes, high blood pressure, or a family history of heart disease, she is more likely to have a heart event compared to a man with the same risk factors. In recent years, even more risk factors for heart disease have been recognized, and all of these are more common in women. Having a lower socioeconomic status increases the chance that someone will develop heart disease. And women are more likely than men to have a low income. Other risk factors for heart disease that affect women more often than men include being a caregiver, having depression, and experiencing intimate partner violence. Women also have some unique risk factors, such as having metabolic problems in a pregnancy, having preterm delivery, and early menopause.
Heart attack symptoms are not recognized in over 50% of women, or they can be silent. Women's symptoms are often labeled atypical because they differ from classic symptoms found in men. Symptoms are sometimes downplayed as anxiety. The most common heart attack sign is chest pain or discomfort, called angina. While both men and women often report angina before the heart attack, many women also experience other symptoms, such as shortness of breath, pressure or pain in the lower chest or upper abdomen, dizziness, lightheadedness or fainting, and extreme fatigue. Several tests that are commonly used to diagnose heart disease have been shown to give inconsistent or confusing results. Because of this, and the differences in women's symptoms, diagnosis of heart disease in women can be missed or delayed, leading to delays in treatment. For example, electrocardiograms and stress tests are less likely to detect heart disease in women.
Women often have different types of heart disease than men, and these conditions have not been studied as much. Microvascular disease, spontaneous coronary artery dissection, known as SCAD, and heart failure with preserved ejection fraction are all common types of heart disease in women. While the medical community is aware of these conditions, the scary fact is that heart tests are not as effective at finding these types of heart disease before a heart event occurs.
When women do get properly diagnosed with heart disease, they often receive less treatment. The result is that women don't always get the right care, and sometimes their outcomes from interventions can be poorer, potentially due to some of the differences in their hearts we talked about earlier. After a heart event, women are less likely than men to be referred to cardiac rehabilitation programs. Cardiac rehab is known to keep women alive longer, living with better quality of life and experiencing less depression. Work with your healthcare providers in cardiac rehab as well as your other specialists to get the care you need.